Hello everyone, welcome to Dosifacts. Today we will see a short topic on how to do dose adjustment in renal disease patients using creatinine clearance levels. So for this we use the formula called as Cockcroft-Gault equation. This estimates the creatinine clearance in ml per minute. So here we see the formula goes by 140 minus age into weight by 72 into creatinine clearance. So in case of male, you use this alone, and if it is a female, then you multiply the answer by 0.85. Since female are meant to have lower body mass when compared to the male, that is why we do this multiplication. So based on the answer we get, we are going to stage the chronic kidney disease into 5 categories. So if your creatinine clearance is more than 90, your kidney function is said to be normal and you don't need any adjustment. You can give the normal dose. If it is mild, that is 60 to 89 ml per minute, then you have to give a minor dose adjustment, or you can just give the normal dose and closely monitor the patient for any deterioration in the kidney functioning. So if that is going to happen, then you have to reduce the dose further. For a moderate case, that is 30 to 59 ml, you have to give a significant dose reduction and also increase the interval between the next doses. That is, you can give, if it is a 3 times daily drug, then you have to give it 2 times or once daily based on the recommendation of the particular drug. If it is a severe case, that is 15 to 29 ml per minute, then you have to give a major dose reduction, or even in end stage cases, you're going to give only once in 2 days, once in 3 days, based on the recommendation. So obviously, even this formula is going to have a limitation. That is, it is highly unreliable for AKI patients. You have to give only for CKD patients. This formula is assumed for chronic kidney disease where the creatinine levels are highly stable. Either you're going to have a stable increase or stable decrease, or it is going to be normal. Okay, that is normal in the sense normally high. But whereas in case of AKI, the patient is going to have a steep increase or steep decrease, positively false positive, false negative. You can have these cases. So it is highly unreliable. And in patients with very low muscle mass and very high muscle mass, you have to use their ideal body weight or adjusted body weight based on the case. And it is going to be highly unreliable because the patient is going to have excessive creatinine production because they have higher muscle mass, or very low creatinine production though their kidney is deteriorated because they don't have much muscle mass. So you cannot use this formula for them. Then whatever value you're going to get, you're going to either reduce the dose or increase the interval, as we've already seen. So you're not going to do this for all the drugs or all the patients with CKD. You're going to do the dose adjustment only for drugs that are 30 to 30% more or less renally excreted, and in creatinine clearance is less or equal to 50 to 60 ml per minute. Only for these two cases you're going to adjust the dose. So on whatever we have learned, we'll see a case. So this patient is a chronic kidney disease patient who is currently admitted for UTI, and his drug of choice is ciprofloxacin. Okay, and we require the patient's age, weight, and serum creatinine levels to substitute in the formula. So let's do that. The standard number is 140 minus age is he's a 68-year-old and his weight is 65. We get the value as 32.5 ml per minute. Use a calculator. So with this value, we can stage the CKD, where we have already seen it comes under the moderate, that is 30 to 59. Our patient was 32.5, so it is moderate case. So you have to give a significant dose reduction or increase the interval. Any one strategy we are going to use. So next is what you have to think. Does ciprofloxacin really require a dose adjustment? You have to go and check that. And see, ciprofloxacin is renally excreted 40 to 50%. We already saw about 30% we have to give a dose reduction. So yes, ciprofloxacin requires, and our ml per minute is 30 to 50. And so we can give 500 mg once a day or 250 mg every 12 hours for this patient. Other drugs that require dose reduction is piperacillin, tazobactam, vancomycin. So generally in patients, you can give 2.25 grams. Renally affected patients, you can give 2.25. Normal patients will receive 4.5 grams. So like that for many drugs you can do. And where will you learn this is you have many recommendations. If it is an antimicrobial, like have you seen of vancomycin or levofloxacin, ciprofloxacin, for all this you can definitely use Stanford guidelines. It is very good. And if you have access, you can use Lexicom, Micromedex and all for referring the recommendations. Otherwise you can simply use drug FDA drug label or the particular country's drug label to see the recommendations for a renally affected patient. Otherwise, you can simply calculate them in a global RPH or MD calculator, or many other websites that are available on the Google. So it is very easy to calculate. So do try out in your regular cases and practice. Thank you for watching the video.